Hello everyone, it's Thursday. For most of my life, I've flown by the seat of my pants when it comes to many aspects of political discourse because, well, to be honest, I just don't care. When I turned 18, I loathed the thought of having to register to vote because it wasn't something that really mattered to me, nor was it something that I felt was applicable to me. Even now as an adult, I still find the whole process of voting to be very taxing and at times inconvenient. Fortunately, voting is not what I wish to talk about today, though it might be something I'll touch on in a different video, but I do want to talk about something that I've heard about for many years, but never quite fully understood, and quite honestly, even after researching information for this video, still don't feel completely sure on, and that is, what exactly is universal health care? Slight caveat here, I am not an expert in any medical or political field, so if I say something wrong, please let me know in comments. I will put links to all of my sources in the description to verify where the information that I'm saying is coming from. So here in America, when I go to the doctor's office for any kind of appointment, whether it be for a cold, for some sort of therapy, or just a wellness check, I present them with my insurance card, whereby then they take that and enter the necessary information into their computer. I then pay a co-pay, which is a flat fee, such as $30, that is required in order to receive the medical service. The insurance company would then pay for the remaining amount. So say a doctor charges $200 for an office visit. Instead of me paying $200, I would pay $30 and the insurance company would pay for the remaining $170. For the most part, under a universal healthcare system, there aren't any co-pays because the care is offered by the federal government, who funds it. Now, funding can also come from other areas as well, such as income tax or the purchase of health insurance. In some cases, a co-payment may be necessary, but only up to a certain capped amount. In short, according to the World Health Organization, universal healthcare means that all people can use the promotive, preventative, curative, rehabilitative, and palliative health services they need of sufficient quality to be effective, while also ensuring that the use of these services does not expose the user to financial hardship. Many developed countries, such as the Netherlands and Switzerland, have a certain type of a universal healthcare system. But even so, they aren't necessarily the same from country to country. The most common form of a universal healthcare system is the single-payer system, also known as a public insurance system. As defined by Dr. Andrea Christopher in a blog post from June of 2016, in a single-payer healthcare system, rather than multiple competing health insurance companies, a single public or quasi-public agency takes responsibility for financing healthcare for all residents. That is, everyone has health insurance under one health insurance plan and has access to the necessary services. Those who favor this type of care say that the United States would benefit greatly from this type of plan because it would create equality for those Americans who are either underinsured or not insured at all. It would also better control costs and prevent wasteful spending on needed resources. Now, the single-payer system is not the only route you can take. Some countries manage to have all of their residents insured while still spending less per capita than the United States. In countries like previously mentioned Switzerland and the Netherlands, residents are required to purchase insurance from a private carrier. But the country's practice in doing this is different. Some have a national marketplace, while others have a regional one. Some countries' plans cover dependents, like children, while others require them to purchase separate plans. Now, just like with anything good, there also comes the bad. And with universal health care, one of the biggest disadvantages to adopting it would mean that all residents would essentially be required to pay for other people's medical care. It can also overwhelm government budgets and could possibly decrease the overall care from doctors who are not paid well. It occurs to me that these disadvantages seem somewhat trivial, but I still find myself asking the question, why is the United States one of the only advanced countries without universal health care? Basically, according to an article from October of 2016, there are 3 reasons for this fact. The first and most blatant is that we don't want it. As our founding fathers sought to have the government play a limited role in our society, having a healthcare system that's run by the federal government would clash with his ideology. Second, the role interest groups play would be vastly different, possibly non-existent, under universal coverage. Private insurers, so they say, would be out of the picture, though, as previously mentioned, other countries have found this to actually work under a universal system. And third, our political foundation makes it difficult to begin massive entitlement programs like universal coverage. The way America is politically tiered doesn't allow for something like a universal healthcare system to work efficiently. Any kind of reform needs to pass through the seemingly never-ending course that is our congressional system that anyone who has ever watched Schoolhouse Rock would know about. This is where I'd play the Bill song. I'm giving you a screenshot instead. It's not quite clear if the United States would ever adopt a form of universal health care. It's been said that the Affordable Care Act, instituted by President Obama in 2010, was the country's first step at achieving some sort of universal coverage, but in the 9 years since its signing into law, some have found the act rather flawed and, ironically, unaffordable. Would I like to see some sort of universal coverage in America? I mean, I don't know. The arguments for it, when simplified to meet my understanding, seem to be much more convincing than those against it, but as I said before, I am not an expert in these fields of study because my mind does not work that way. Personally, I would love for everyone in America to be able to afford some sort of health care, because I feel that everyone deserves the right to a full, healthy life. And I think that's the most important thing. Don't you? God bless. I'll see you all later.